Hi everyone, my name is Emma and I'm going to be presenting on Croup today. For the chief complaint, my child has been having trouble breathing and has a cough that sounds like barking, especially at night. I just wanted to play a quick audio clip of what this cough sounds like. And when we look into her history, we can see that she is previously healthy with no history of chronic respiratory issues such as asthma or recurring respiratory infections. She's all up to date on vaccines, taking no daily medications, no known drug, food, or environmental allergies, and no surgical history. And when we look at her family, we see no family history of asthma, chronic respiratory diseases, or congenital airway abnormalities that could be contributing to her symptoms. And the family history is otherwise non-contributory. Nothing in her family history can tell us any answers about what she's experiencing. And as for social, she lives with both parents and a 5-year-old sibling, which is important to note because that 5-year-old could be going to big kid school and bringing back infections and diseases that he could be giving to his sister. She attends daycare 3 days a week with 12 other children, which is also important to note. She's exposed to other young children, which transmit a lot of germs. She has no reported exposure to secondhand smoke, which can indicate some sort of pneumonia or bronchitis or asthma as a result. And the family has one dog at home, but we've already ruled out no known allergies, so that's a little bit irrelevant. And for the discussion question, given that the patient is a 2-year-old with a cough that sounds like barking, dyspnea that worsens at night, and no excessive drooling, which of the following interventions might provide the most immediate relief for her symptoms? So I'm going to pause for a sec. You might want to pause the video if you need time to think. Okay, answer here is C, a dose of oral steroids to reduce airway inflammation. Um, and this is a common and effective treatment for croup. The corticosteroid is typically used, such as dexamethasone. It could be given to reduce that airway inflammation, which would provide the most immediate relief for that barking cough and dyspnea, which it's usually 1 to 2 hours after administration that that her symptoms would subside. Antibiotics is an incorrect answer because croup is typically caused by a viral infection such as RSV, parainfluenza, or adenovirus. It's not necessarily a bacterial infection. So if you gave her antibiotics, they would only be contributing to antibiotic resistance and it wouldn't actually solve any of her symptoms. Tylenol to manage a fever, yes, it did reduce her fever, but it wouldn't be addressing the underlying airway inflammation causing the breathing difficulties, which is the primary aggravator in this instance. And a bronchodilator to open up airways like albuterol, this would not necessarily be the first priority or even a priority at all because these drugs relax the muscles in the lungs to make breathing easier. And so they target the lower airways as opposed to the upper airways, which we see the inflammation in the larynx and the trachea, the more upper airway areas. So if you gave her a bronchodilator to open up the lower airways, it wouldn't target the actual inflammation that we're looking at with croup. So croup is a very contagious respiratory infection that affects young children, particularly 3 months old to 5 years old. This is reason for this is that they have smaller airways, and after the age of 5, kids grow, their airway grows as well, and the likelihood of inflammation causing that distinctive cough is a lot lower. The condition is characterized by swelling of the larynx and trachea, as I said, which causes that distinctive cough and labored breathing sounds, along with everything else that the child is experiencing. Again, it's typically caused by a viral infection such as parainfluenza. And that swelling of the larynx and trachea is why it is also called laryngotracheitis. And it's also called barking cough as another name. Some of the prefix and suffix associations. Laryngo is referring to the larynx or the voice box. Trachea is referring to the trachea or the windpipe. And itis is inflammation. So together it's inflammation of the larynx and trachea. So some of the associated symptoms, the early symptoms tend to begin with a common cold. The child gets infected with parainfluenza virus and they get that classic sore throat, runny nose, sometimes a low grade fever. And if there's enough swelling and irritation in that laryngotracheal area, croup will develop. It's kind of a self-fulfilling cycle. If you're coughing a lot, that's going to inflame your trachea. And if your trachea is inflamed, it's going to be irritating. You're going to cough more and it just makes it worse and worse. Later symptoms, they range from mild to severe. That barking cough that gets worse with crying, coughing, anxiety, and distress, hoarse voice, fever. It ranges with severity of infection. It can be mild to moderate, and loud labor breathing, high pitched sound when the child breathes in due to narrowed airways, which is called a stridor, that sound. It's called an inspiratory stridor when you breathe in and that high pitched sound occurs. Symptoms tend to worsen at night. This is because of the adrenal regulation of cortisol, which is the natural hormone the body produces. It's an anti-inflammatory hormone, and this tends to decrease at nights, which exacerbates the symptoms. And in severe cases, cyanosis can occur, which is that blue skin tint due to lack of oxygen. So some of the things that you would find in a physical exam of this child would be, again, that barking cough, stridor upon inhalation, that inspiratory stridor, and a hoarse and raspy voice due to that irritation, and labor breathing signs such as tachypnea, which is the fast breathing. You're trying to get more oxygen into your lungs, and so therefore breathing faster and breathing for longer, so a prolonged inhale, and nostril flaring, especially in children, which indicates increased effort to try to get air. And as for the general appearance, agitation or anxiety, that child is probably anxious or irritated, that they cannot get enough air, it's uncomfortable, and that worsens symptoms because when you're anxious, you breathe more shallow and rapidly. And again, in severe cases, cyanosis. As for vitals, it's typically mild to moderate fever, 99.1 to 102.2 degrees Fahrenheit. It's not typically a severe fever past 102. And oxygen saturation, below 95% oxygen saturation is abnormal. So if you see anything below that threshold, that means the child's not getting enough oxygen, and therefore would need immediate treatment, such as oxygen supplementation. And the reason I ask or include drooling is commonly present with other respiratory conditions like epiglottitis. The epiglottis is that small cartilage lid that covers the trachea that prevents food and water from entering. And when it's inflamed, it typically causes difficulty swallowing, which results in drooling. So some imaging that you could do. Croup is typically diagnosed by clinical presentation only, but neck and chest x-rays can aid in diagnosis and can rule out other respiratory infections with very similar symptoms. In pediatric patients, you can see that inverted V below the vocal cords. It's called the steeple sign. It's that inverted V that resembles a church steeple. So you look for that when you're trying to diagnose croup. Some possible treatments, like I said, a corticosteroid may be given to reduce that inflammation in the upper airway, and that would reduce the symptoms of the barking cough or the labor breathing if the child is really not getting enough oxygen. It can be a single shot or a single dose in shot form, like you get it at urgent care, send the child home. It's long lasting. It lasts for 3 days or so until the infection resides, or pills taken over several days until the infection passes. And like I explained, these corticosteroids are synthetic drugs that are similar to cortisol, which the body produces from the adrenal glands. It mimics that anti-inflammatory effect of cortisol, and the physician can adjust the dosage to how much you need. If your body isn't producing enough cortisol, you can get more in a synthetic variety. And this is more severe cases, but if SpO2 or the oxygen saturation is abnormal, a mix of helium and oxygen, which is called Heliox, can be administered through that nasal cannula that goes under your nose, or just a whole face mask, like in that picture. And that can aid in raising the blood oxygen levels. This will be supplementary to a pharmaceutical intervention. It wouldn't primarily just be by itself. And it's typically when the child shows signs of respiratory distress. And so a big part of croup treatment is just letting the infection pass. It's uncomfortable and aggravating, but you can use a humidifier with warm, moist air to relax the vocal cords. You can use cold air from outside or even hold your child up into a freezer. That cold, wet air helps relieve the stridor and reduce inflammation. It's not necessarily cold, dry air that is irritating and it actually increases the stridor. It doesn't take it away. And acetaminophen or ibuprofen or Tylenol or Advil, like over-the-counter fever reducers and pain relievers, can help lessen the discomfort. So here are my references, and thank you very much. Okay, stop recording.